Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are especially designed for you. You can also connect with BCDA through our agency's multimedia platforms that include our website, Facebook, the Time of Your Life Digest, Flickr, and Map, as well as an abundance of printed resources. Today's show features a variety of fun and useful information for this holiday season. We'll learn about how the Because program facilitates free home improvements for older adults in Baltimore County, allowing them to age in place with comfort and dignity. Then we'll learn about some wonderful holiday gift ideas with representatives from Senior Box Office and Senior Craft Gallery. But first, we begin today's show with a popular and important topic, especially during this time of year. Yes, you've guessed it, Medicare open enrollment and benefits. Let's start the show with Allison McMichael-Dahl of the State Health Insurance Assistance Program named SHIP. Allison, thank you for being on today's show to tell our viewers about the Medicare open enrollment.
Absolutely. I'm glad to be here and thank you for having me.
Prior to starting our conversation about Medicare Part D, can you briefly share the responsibilities of the BCDA SHIP office?
The Baltimore County State Health Insurance Program, also known as SHIP, office provides objective, non-biased education and assistance to individuals eligible for Medicare, their caregivers, and the family members, as well as the people with 25 months of Social Security disability. We assist with anything between reviewing coverage options, Part D prescription plan selection, Medicare billing help, and screen individuals for Medicare savings programs such as QMB, SlimB, Extra Help, and SPDAP.
Allison, SHIP provides an invaluable service to Medicare beneficiaries. Let's begin by talking about Medicare eligibility and enrollment. What are the basics that viewers can be aware of?
Those who are turning 65 or have had Social Security for up to 24 months are eligible to enroll in Medicare. The initial enrollment period, also known as an IEP, is a total of 7 months. That means there's 3 months before their 65th birthday, the month of their 65th birthday, and the 3 months preceding their 65th birthday is their initial enrollment period where they can sign up for Parts A and Part B through Social Security Administration. They can make an appointment to go in person. They can do it online at Medicare.gov. This is also a great time to get your Medigap and supplement plans. You definitely want to pick it up during this window. If you miss the opportunity to pick up a Medigap plan now, you may not be able to get one in the future. If you do miss your initial enrollment period for Parts A and Part B, there is a general enrollment period, which happens January 1st through March 31st. It's important to note that if you are missing your initial enrollment period, you may face a penalty if you do have to sign up during the general enrollment period.
It sounds like older adults have more choices than ever when it comes to Medicare. Can you further clarify the differences between original Medicare and the Medicare Advantage plans and the pros and cons of each?
This is a great question and one that comes up very often. Original Medicare is Parts A and Parts B. So it's traditional. This is the program that runs by the federal government and it includes Part A, which is your hospital insurance. So that covers inpatient hospital care, skilled nursing facility, hospice, and some other health care. Part B is your medical insurance. This covers doctor visits, outpatient care, preventative services, lab tests, and durable medical equipment. How it works, you can go to any doctor or hospital in the United States that accepts Medicare. No networks or referrals is required. You can also add a Part D, which is your prescription drug plan for medications, and a Medigap supplemental to help pay for the out-of-pocket costs like the deductibles and the co-insurances. Some pros about sticking with original Medicare, you have broader network coverage, so freedom to see any provider that accepts Medicare. You often do not need a referral to see any specialist. It's also predictable benefits and government oversight, and it works well for people who travel frequently or live in multiple states. Some cons to just having original Medicare, no out of pocket maximum, so your costs can add up pretty quickly. It does not include dental, vision, or hearing coverage, and separate plans may need for a prescription drug plan, a Medigap, which means multiple premiums. Um, Medicare Advantage, also known as Part C, is a plan that that is a private insurance companies approved by Medicare. These are plans that combine parts A and B and usually include part D and some other special things. Most plans are HMOs or PPOs, meaning that you typically need to use doctors and hospitals in the plan's network. Extras often include dental, vision, and hearing benefits, gym memberships or wellness programs, over the counter allowances, so for if you're over counter drugs, sometimes transportation to appointments, and additional things such as meals if you end up coming out of the hospital and you need assistance with meals. Some pros: one plan and one card for all coverage. So that would be your medical, your drug, and all the extras. Many plans have low or zero monthly premiums, though you still have to pay for your Part B premium. It includes out-of-pocket maximums, which protect you from overly over medical cost, and often includes extra benefits to original Medicare does not. Some cons: you must use in-network providers. You may pay more to if you go to a provider that's outside of network. May require referrals and specialists. Coverage can vary by county or region, or moving can affect your plan, so you'll have to change that. And cost and benefits can change yearly, requires annual review during open enrollment season.
So, from what you said, Medicare is broken down into a variety of different parts, which
Mhm.
I'm sure can be confusing to our viewers. Can you please provide a brief description about each benefit and what they cover?
Absolutely. So we've already kind of talked about parts A and parts B. Your part A is your hospital, your part B is your medical, and then you have your drug plan, your prescription drug plan. You have a supplemental plan, which is actually a plan that could be a variety. I believe there are 12 plans that are offered in the state of Maryland that we can use, and they all have different letters, but they all have each plan is the same and they all offer the same platform. So if you have an A platform, it might be sold to you by a different private insurer provider. However, it's the same plan for every private provider that's selling it to you. And then you also have your part C, which, like I said, is like the cupcake with all the sprinkles on top of it. So it has your part A, your part B, and all of the additional things: your drug plan, hearing, vision, and all of the great things that come with that.
So, Allison, I'm sure our viewers see ads on TV mentioning Medicare Advantage programs have a give back program alluding to Medicare Advantage plans having little to no copay. Can you please address these programs?
Yes, these TV ads, they claim that you can get money back in your Social Security check or get Part B for free. These ads are referring to what known as a Part B premium give back or Part B rebate, a feature available in some Medicare Advantage Plan Cs. What it really means is every person with a Medicare pays for a Part B premium. In 2026, that's going to be about $206.50. Some Medicare Advantage plans offer a give back, a portion of the premium. Here's how it works: the plan pays for part of it, of your Part B premium, on your behalf. You'll see a larger Social Security check each month because less is being deducted for your Part B premium. For example, if your monthly Part B premium is $178 and your plan gives you $50, you're only going to see a reduction of $128 out of your Social Security check.
It's no secret that Medicare changes annually. Allison, could you please inform our viewers as to what the biggest change to Medicare this year is from last?
Absolutely. So there was lots of changes coming down the line in 2026. If you have a Medicare Advantage plan, you'll see an increase of your premiums by about 5.06%. Some other big takeaways is Kaiser is closing three of their plans and launching four new Medicare Advantage plans and four new dual SNP plans, which are special needs plan. Kaiser and Hopkins are also discontinuing their zero premium plans, and then several dual SNP plans are having reductions, like Humana, Aetna, Bravo Health, and UHC. There are other benefit reductions through Kaiser as well as Hopkins. Some other things that we're going to see coming down the line are a lot of deductibles and premium changes. For Part B, the premium change from 2025 was $185. It's now going to be $206.50. The deductible for 2025 was $257. It's now going to be $288. So an increase about $30. Your Part D deductible is also going up to $610. And one of the most important things to know about is your Part D out of pocket max, the catastrophic coverage. In 2025, that was $2,000. And in 2026, it's going to be $2,100. There's also some changes to Medicare savings programs. For example, the extra help copays have changed. And have increased so that your generic drugs are going to be $5.10 and brand name drugs are going to be $12.65. And if you receive the Maryland Senior Prescription Drug Assistance Program, you will be getting some more help for your prescription premiums. It was $75 in 2025, but we're looking at $100 towards your drug premium in 2026.
Thank you for clarifying these available programs for our viewers. Now, can you please explain how viewers can make an appointment with SHIP and what they can expect when they arrive?
We are currently halfway through Part D open enrollment. We're actually going to be ending the season on December 7th. So it's really important that you are making your decisions now so that your plans are going to start ready on January 1st. If you're interested in an in-person appointment, you should make a phone call to 410 887 2059 to make your appointment today. When you come to your appointment, it's really important that you bring your ID, your medication list with you, your Medicare card, and if you do have your prescription drug plan, it's really helpful if you bring that card as well. I also want to encourage you to bring your Medicare.gov login account and password, as it really makes it easy for our counselors to help you assess and review your prescription drug plans and make sure you are in the best plan for 2026.
I'm told the SHIP office releases a monthly Medicare Minute webinar where viewers can learn more in depth about the various facets of Medicare. What sorts of topics do you discuss, and where can viewers find it?
Yes, the Medicare Minutes are 5 to 30-minute presentations that do a deeper dive into Medicare topics like durable medical equipment, what a Medigap is, the difference between original Medicare and Medicare Advantages, what open enrollment is and what does that include. You can view them at the Baltimore County Department of Aging YouTube account. They are put up every month at the beginning of the month.
Allison, thank you for coming on the show to discuss the intricacies of Medicare and how Baltimore County's SHIP office can help older adults navigate them.
Absolutely. It was an honor to be here. Thank you so much.
We're going to take a short break, but first, join approximately 8,000 mature adults who subscribe to BCDA's newspaper, The Time of Your Life Digest. Subscriptions are reasonable at $5 annually for Baltimore County residents over 60 years of age and $7 for those under 60 who are Baltimore County residents or those residing in other counties. For information about becoming a subscriber, please call 410-887-3050.